Hair loss, what it could indicate about your health. Hair loss is a common concern that affects both men and women, and while it's often seen as a cosmetic issue, it can sometimes be a sign of something more serious happening inside the body. One of the most common causes of hair loss is genetics, specifically male or female pattern baldness, known as androgenetic alopecia. However, when hair loss occurs suddenly or excessively, it could point to other health issues that are worth investigating. Nutritional deficiencies are one of the first areas to consider. A lack of essential vitamins and minerals, such as iron, vitamin D, zinc, and biotin, can disrupt the normal hair growth cycle, leading to hair thinning or shedding. Iron deficiency, for example, is particularly known to contribute to hair loss, as it impacts the oxygen supply to hair follicles, weakening their growth. Similarly, vitamin D deficiency has been linked to hair loss conditions like alopecia areata, an autoimmune disorder that causes sudden hair shedding. Thyroid imbalances, both hyperthyroidism, overactive thyroid, and hypothyroidism, underactive thyroid, are other common culprits behind hair loss. The thyroid gland plays a critical role in regulating metabolism and overall hormone production, and any imbalance in thyroid hormones can disrupt the normal hair growth cycle. Individuals with hypothyroidism may experience thinning hair, while hyperthyroidism may lead to more diffuse hair loss. Both conditions require medical intervention, as untreated thyroid problems can lead to more severe hair loss and other health complications. Hormonal changes are another major factor. For women, pregnancy, childbirth, and menopause can cause significant hormonal fluctuations that affect hair growth. During pregnancy, elevated levels of hormones like estrogen can promote thicker hair growth, but after childbirth, hormone levels drop, leading to postpartum hair shedding. Menopause, which marks the decline of estrogen and progesterone, can also lead to thinning hair or even bald spots as the body's hormones shift. Autoimmune conditions, such as lupus and alopecia areata, can trigger hair loss as well. In autoimmune diseases, the body's immune system mistakenly attacks its own tissues, including hair follicles. Alopecia areata, for instance, causes sudden, patchy hair loss due to immune cells attacking the hair follicles. People with lupus may also experience hair thinning or loss as the disease affects the skin and scalp. Chronic stress is another common yet often overlooked cause of hair loss. Prolonged emotional or physical stress can lead to telogen effluvium, a condition where a large number of hair follicles enter the resting phase prematurely, causing hair to shed. This type of hair loss is typically temporary, but it can be distressing. Managing stress through techniques such as meditation, yoga, or regular exercise can help reduce the impact of stress on hair health. Additionally, certain medications can also contribute to hair loss. Drugs used for conditions like high blood pressure, depression, arthritis, and cancer treatments, such as chemotherapy, are known to cause hair thinning or shedding as a side effect. If hair loss begins shortly after starting a new medication, it's important to consult a healthcare provider. Infections and scalp conditions, such as fungal infections or dermatitis, can cause hair loss as well. Fungal infections like ringworm can lead to patches of hair loss on the scalp, while seborrheic dermatitis, which causes an itchy, flaky scalp, can interfere with hair growth and cause shedding. Proper treatment for these scalp conditions is necessary to restore healthy hair growth. The body's overall health status plays a significant role in hair health, and any condition that affects the body's internal balance can have a direct impact on hair growth. Managing hair loss begins with understanding its cause. If the loss is sudden or accompanied by other symptoms, it's essential to seek medical advice for a thorough evaluation. A healthcare provider may perform blood tests, scalp biopsies, or other diagnostic procedures to determine if there are any underlying conditions contributing to the hair loss. Once the cause is identified, targeted treatments such as medication, lifestyle changes, or even surgery, in extreme cases, may be recommended.